Alrighty, so this is going to be the final video of the physiology and pathology series. We have a few systems to cover. It won't take too long, so hopefully it won't be more than an hour. And then we'll leave the rest of the night for questions and answers. So we last left off with the cardiovascular system. So first, we want to understand the functions of this system, and then, of course, how it can be in dysfunction. So first, what is our cardiovascular system responsible for? What is the main purpose of the cardiovascular system? Well, we can pretty much think of the cardiovascular system as a pickup and delivery system. So essentially, our blood transports a whole bunch of things within it, and the heart is pumping that blood through the entire body to bring the supply of nutrients and everything to cells, and then carry the waste from those cells away. So first and foremost, of course, we have transportation. So the cardiovascular system is responsible for picking up all the materials, the waste product, that's metabolic waste from cells, and then of course bringing new nutrients to the cells. So, of course, our blood also circulates with a bunch of things in it. It circulates with the red blood cells, known as erythrocytes. It circulates with white blood cells, known as leukocytes. It also contains thrombocytes, known as platelets, which are responsible for blood clotting. So when we get a cut or a scrape, that will coagulate and solidify and then, basically plug up the cut or whatever you might have abrased yourself with. So the red blood cells carry, all the nutrients and stuff like that, carbon dioxide and oxygen. And then the white blood cells serve as the immunity response, because white blood cells are, responsible for killing off pathogens. And, there's tons of different white blood cells, and they all have different responsibilities. But the basic premise is to remove pathogens. So combating hemorrhage goes with the blood clotting. As we said, the platelets, the thrombocytes, create what's called platelet plugs, and they stop the loss of the blood out of the cardiovascular system, out of the blood vessels. So when it comes to our benefits of everything, like what are we looking at, right? We want to understand, like, how does massage benefits this system, and what are some things to consider? And so pretty much all of our coming up pathologies will revolve around these key points here. So one, massage, of course, increases our state of mental relaxation, but as well as physical relaxation. And so whenever our bodies are relaxed and we're engaging the parasympathetic division of the nervous system, a lot of things happen. So we go back to the lecture on the nervous system itself, and we saw that the parasympathetic system governed, the reduction of heart rate and blood pressure. And so, well, clearly those are directly correlated to this system. And so therefore we can gather that just relaxation in general, because of massage, would then, benefit the cardiovascular system in those regards. So, of course, massage itself can improve and increase and move the fluids of the body, including the blood and lymph. And so when we work an area, right, we can essentially help promote the flow of blood, which can be to our advantage as well as to our disadvantage for certain conditions, as we'll see in a little bit. And there is some research to suggest that massage, as well as other physical activity, can increase the level of platelet counts in the bloodstream. And so this is one postulated reason that massage leads to the tissue repair of the body. So what are some of our complications, right? So one, of course, is understanding the medications that people could potentially be on. So, having your, base knowledge of pharmacology, where, you know enough that, someone on a blood thinner, right, the body is susceptible to bruising and can be bruised quite easily through massage. Understanding that, hypertension, high blood pressure will be treated most likely by a medication, and they could be on a medication. And of course, massage can affect the circulation of certain medications in those regards, right? So as we go down the list, you can see that, even though we talked about hypertension, low blood pressure is actually, deemed as a contraindication as well, because massage has been shown to lower levels of blood pressure. So if someone is already low blood pressure, which is, a pretty big concern, massage could increase that effect. And so then it would be basically like doubling down. So if someone is prone to having blood clots, if they've had blood clots before, heart attacks or anything like that, they more than likely would be on a blood thinner, which poses its own contraindications. But it does raise concerns and red flags in regards to our massage, because we would want to, be careful of our circulatory-based styles of massage, where even though there is no evidence to support that massage has ever dislodged a blood clot, it's why chance it, right? So other considerations too is that people could also have, stents or ports or pacemakers placed in, and so typically they would be on the left side of the body, obviously to get to be as close to the heart as possible. So usually, and it's usually working usually in the pectoral region. So working in the pectoral region is a concern in some cases. You might even find that someone might have a pacemaker. You might even feel the outline of it. Sometimes it's actually quite noticeable, sometimes it's not, but that's also a consideration as well. So let's go ahead and get into some of the pathologies, and we'll see that some of those just general considerations and everything really stand out. So our first condition up is anemia. Anemia is quite common. We probably know a lot of people who have anemia or forms of anemia, which there are many forms of anemia. And as a matter of fact, I am technically anemic as well, in having thalassemia, which again is a form of anemia. But anyways, if we break that word down, emia is a blood condition. So anytime you see emia, think that it's some sort of blood condition. And so what exactly is anemia? So there are many different types. Some of the bigger types would be like sickle cell, one of the most commonly heard about types of anemia. And essentially that distorts the shape of the blood cell itself. And in some cases with anemia, people's low red blood cell count is usually lower than normal as well. So the problems with some of the types of anemia, especially like sickle cell, the blood cells can actually get caught. And so sometimes anemics can be prone to developing blood clots. But it also distorts the way in which the cells can carry oxygen as well. Especially for my case with thalassemia, it reduces my blood iron is actually a lot lower than it normally would be. So that would affect the rate or the amount of oxygen that can be transported in my blood. So, what do we consider about that? Well, typically low blood iron and the fact that we're not able to circulate oxygen as proper usually leads to lethargy, tired. Like everyone's always wondering why I'm yawning all the time. And it's like, well, literally like, I just have to like breathe so deeply so often. And just, well, that's one of the big purposes of yawning, is to just taking a giant gulp of air. But, in some harsher conditions or cases, people can become dizzy, disoriented. Sickle cell can actually like almost come in exasperations, and they could, be quite disoriented and dizzy. So essentially, our style massage should be, rather relaxed, rather, non-aggressive. And, of course, if they come across any complications of dizziness, nausea, or anything like that, then we would want to consider those, right? Because, you know, a client that's dizzy is a contraindication for massage, because as they get up off the table, they become a fall risk. And well, we just don't want that. So if they do, you know, say that they're feeling dizzy, you know, you can just have them sit up on the edge of the table for a while before they actually physically get off of the table itself, and stuff like that, you know, especially making sure that they take their time getting off of the table, because as we know, you know, it's very common that, you know, just normal massage makes people what we call massage drunk. And so if you're anemic and they, you know, become dizzy or disoriented, and it adds to, or is added to the massage drunk effect, right, they become even more of a fall risk. Angina pectoris. So again, we can use the name here to kind of tell us a little bit about what's going on. So first off, anytime you see angina, know that as chest pain. So angina pectoris is pain, well, in the chest region. And so this is usually like a precursive episode of a heart attack. And so it is essentially a heart attack, though the pathways of blood to the heart aren't completely obstructed necessarily. So it just limits the blood flow, which then causes, you know, that deep pain in the chest, or the deep, you know, just pressure in the chest feeling kind of sensation, right? And so, you know, what are our considerations around that? Again, you know, when anytime that we have issues with the circulatory system, circulatory style of massage is something that we'd want to be very careful with, right? Because if the heart itself is, you know, already having an issue with the circulation of blood through it, when we push more blood into that system, or into the heart, or towards the heart, then we're just giving it more work to do, right? And obviously that could be, you know, a very negative situation. Other things to consider around angina pectoris, and, you know, a lot of these subsequent conditions here, is that they more than likely have other associated diseases regarding the cardiovascular system, such as atherosclerosis or congestive heart failure, anything like that. And of course, they would more than likely be on some sort of medication. So they could be on some kind of beta blocker, as mentioned here. They could be on a nitroglycerin medication. They could even just, you know, have aspirin, right? So aspirin itself too also will thin the blood. So if they do have, for any time that you do have a client who does have some chest pain and they do have medications, you know, maybe you can find the medication for them. Of course, if they can administer themselves, don't just shove a pill down their throat, because then you got a choking client on top of a client having a heart attack, right? Don't want that. But if they do have any medication regarding their condition, then you can just get that for them. If they're able to, they can take the medication. And then, of course, if things get really severe, as we'll look at with the myocardial infarction, then, you know, we'd want to immediately, you know, as soon as possible, you know, call paramedics. So our next condition here is atherosclerosis, which is a hardening of the arteries due to plaque deposits in the arteries themselves. So this usually comes in the form of like cholesterol. So typically your clients with high cholesterol levels, high triglyceride levels, usually can, you know, be prone to developing this condition. And so one, this impedes the blood flow through the blood vessels itself, and can eventually just restrict blood flow so severely that, you know, the insufficient amount of blood getting to an area can become a problem, as well as it's quite possible that this blockage could build up blood, you know, down the tube, basically, in a sense, and cause a blood clot and cause the development of a blood clot. So if you do have a client who has, you know, diagnosed atherosclerosis, you know, do screen for other heart conditions like the congestive heart failure, if they had a heart attack, anything like that. Are they on any medications for heart conditions, especially their you know, current condition of atherosclerosis? And do screen for possibilities of a blood clot as well. So there's things to consider too. Again, going back to the circulatory style of massage, you know, be very mindful and considerate of that style of massage. As mentioned here too, it says, they might have muscle soreness and stiffness in certain areas, right? Especially because that, usually with heart conditions and heart problems of that nature, usually implementing physical activity and exercise is, usually a good, healthy lifestyle change, obviously, because, cardiovascular endurance is developed through physical activity. And so they might be, working out more and stuff like that. There could be potential, reduction in blood flow to certain areas, which could create, pain and pain sometimes in areas. So if they do have localized pain and it's really unexplained, especially if they have atherosclerosis, that could be an idea of like, well, maybe where there's some limited blood flow going to. As it says, keep your pressure moderate, to a reduced a moderate level. This goes along with a few factors. One, if they are on a blood thinner medication or anything like that, right, we always want to be mindful of our pressure. If also they do have the potential or possible blood clots, keeping pressure moderate as well is beneficial, right? Because that deep pressure, just like squeezing out and pushing fluid through the especially blood through the cardiovascular system, right? We don't want to run the risk of dislodging a blood clot. Like, even though I said there's no evidence that we ever have, but why chance it? Our next one is congestive heart failure. So congestive heart failure itself is an inability of the heart to pump blood, right? So typically this is usually due to damage or loss of muscle of the ventricles being the bottom chambers of the heart that are responsible for squeezing and pushing blood out of the heart itself. So typically congestive heart failure comes about because of other conditions like a heart attack or coronary artery disease, coronary arteries are the arteries that bring blood supply to and from the actual chambers of the heart itself. So you have, a couple main branches going to each chamber essentially, which, gives you your bypass surgeries basically, right? So when you hear someone having, a single bypass, double bypass, all those bypasses, well, they're bypassing these arteries that are now blocked that would be going to the actual chambers of the heart, right? And so anytime that the blood flow is restricted to the chambers of the heart, as we'll see with the later condition, I mean, they're all just so similar. I know I keep saying that, right? But anytime you have restricted blood flow to parts of the muscle tissue of the heart, the longer that it's not receiving nutrient supply and oxygen, the more and more muscle loss and muscle damage and death of the tissue occurs. And so this leads to, the artery, or excuse me, not the artery, but the heart itself not being able to efficiently pump blood. So again, our same considerations, right? If they're having an issue pumping blood through the heart, circulatory styles of massage would be probably not the best choice. Again, because if the heart is having an issue with working, then pushing more blood to it would just make it work harder and for no good benefit, right? There is some interesting stuff to understand about, having a heart attack and stuff where certain chambers of the heart. So especially if you can get enough detail of your client's condition, if they ever had a heart attack, where did they get damage to in the heart, right? So certain chambers and certain sides of the heart really matter. So as it said here, that if there's damage to the left side of the heart, to the left ventricle, lower artery descending usually is the artery blockage there. then they are very prone to shortness of breath, especially, considering if being lying, face down in a headrest is already tough to breathe. So if they did have damage to the left side ventricle, it could be very hard to breathe. Matter of fact, I have a client that I trained who had a heart attack, and it caused there was a blockage in the lower artery descending, the LAD artery, and he has damage to the left side of his heart. And so he, we work very adamantly to keep his volume respiratory up, right, and keep his breathing good and stable, and be able to do cardiovascular exercises with endurance. So if the right side is actually affected, then you can actually see swelling being a potential side effect. And so sometimes you'll see in the limbs, like the arms and legs, to develop swelling as well. So, it just gives you a good idea of like how you can use your clinical intake, your health history intake, to really understand what's going on with your clients, right? So if you do see the swelling and they had a heart attack, well then, you can kind of associate these types of things. Coronary artery disease is basically, again, a rehashing of everything we've already been talking about. So first off, as we said, and there's the artery I was just talking about, the left anterior descending coronary artery. If you have a blockage of the coronary arteries for whatever reason, through atherosclerosis, blood clot, whatever, then the chambers of the heart are not receiving enough blood. And anytime the chambers of the heart are not receiving blood, you then have tissue necrosis, which is tissue death. And then the heart is starting to decay and loses its ability to function. So again, all the same considerations for the previously mentioned conditions, right? Considering your medications, considering your style of massage, based off of the circulatory style of pressure, everything like that. Our next condition up is deep vein thrombosis. I'm sure you've seen this quite a few times in the book. I know that the particular book we use loves this condition. It's almost in like every other chapter. But what exactly is it? If we break down that word, thrombosis, well, first off, a thrombus is the technical term for a blood clot. So osis means the condition of, thromb is blood clot. So this is the condition of having a blood clot deep within the veins. Now, most commonly, it would be deep veins of the lower leg. As you can see in this picture, it's depicting the calves. So, anytime that I'm worried about someone's, circulation, especially if I'm worried that they would be prone to developing blood clots, I'm always cautious about the calves, because if you're going to develop a blood clot, it's most likely going to have started in the calves, right? So always be very, very considerate, and in some cases, and where it's necessary, be quite reserved with your calf work, right? So especially being very careful of pressure on the calves. I mean, calves in general already don't need a whole lot of pressure for it to feel good. So, being very mindful of your pressure on the calves, especially if they have any heart conditions, is a big necessary thing. So of course, if they have blood clots, then they're going to be on some sort of blood thinning medication that poses its contraindications. If they do have deep vein thrombosis itself, and like they actually wrote it down on their paperwork, like they know they've been clinically diagnosed with this, then like, holy crap, can I at least have a doctor's permission to make sure like he doesn't have any concerns with you getting a massage? And then, maybe proceed with your massage, right? If you feel comfortable and you can work with it. So at best, you're just avoiding the lower legs essentially, and you can just work, mostly upper body, and just be very mindful again of pressure, circulation. And like I said, there is no evidence to the fact that massage has ever dislodged a blood clot. I mean, people can be quite vigorous. They'll jump up and down and do all this stuff and never dislodge a blood clot. So, I mean, is it likely that massage would dislodge a blood clot? Probably not. But again, it's all about risk, right? And why risk it for the biscuit? Don't do so, right? So, screening for DVT, as it's acronymed, is it's possible. It's diagnosed, or well, excuse me, we can't diagnose, but it's recognized because of usually inflammatory markers of the affected leg, but it's not a given, right? Because a lot of times blood clots and everything can be there, and you would never know until it's either too late or you somehow just stumbled upon finding it because maybe you went in for a checkup of something else and they found it. So, always just err on the side of caution and just be careful, especially if you know that this person has other surrounding factors that could lead to blood clots. Hypertension. So hypertension is the technical technical term for high blood pressure. Hyper, well, excessive. Tension, well, of course, in this case, the tension on the arterial walls, blood pressure, right? So high blood pressure is a concern for massage for a few reasons. One is that, if someone has high blood pressure, they have a tendency to have other problems, right? They are at a higher risk of other cardiovascular diseases. They're also at a higher risk of stroke and death. A matter of fact, like 20% of all strokes are caused by hypertension. So if your client is hypertensive, then make sure that they are actually taking medication for this, right? So that way the medication would be controlling their blood pressure. Now, I did say that one of the benefits of massage is shown to have lowered blood pressure in clients. So our massage can help hypertension, help lower the blood pressure. So another thing to consider too is that also lying flat, like on a massage table, can actually increase blood pressure. So in some cases, if your client's blood pressure is maybe a little high that day, as even if they had their medication, it might be best to opt for like a shorter massage and use a chair as well, right? Because the chair won't raise the blood pressure as much as opposed to laying on the table. And then of course, with the relaxation massage, it could help have a positive effect on their blood pressure at that time. So, I mean, if you have persistent clients who come in with hypertension, it might be in your best interest to get yourself a blood pressure cuff, not that one where you have to like literally measure it with, calculating the beats after you release certain levels of pressure out of the cuff. But, you can get one from like Walmart for like $20 that reads it for you. We call them a sphygiometer. You can check your client's blood pressure. That's fine. That's within our scope of practice. We can check someone's blood pressure and take a blood pressure reading. We can't diagnose anything based off of that, right? So, and don't take that number and just run with it like, oh my God, it's so high, and you're just freaking this client out and so on and so forth, because a lot of people's blood pressures can vary. And so, what might be high for one person might be someone else's normal in certain instances. but anyways, again, hypertension can be a contraindication in massage, but again, it's not necessarily a huge concern in some cases, especially it's just erring on the side of caution and liability, right? Because should they so happen to have literally had a stroke of bad luck and it was literally their time to go and they died on your table, that's a problem, right? And we don't want that. So why chance it when we can just make sure that they either take their medication and reduce their blood pressure, and so on and so forth. So again, make sure to do a good health screening of any other conditions. Consider the medications that they might be taking. They could also be taking the beta blockers, again, which help with the heart. Diuretics and everything would also help make them urinate, which reduces blood pressure, as well as vasodilators to reduce blood pressure as well. and blood thinners in general. Other concerns, might as well mention that since I see it there, with hypertension is that, it's very easy to get dizzy, especially going from a lying down position to coming up, right? I mean, think like if you've laid on the floor for a good while and all of a sudden you shoot up real fast, you're like, whoa. Well, imagine if you already had high blood pressure, which just by its nature could make you dizzy. Same thing. So always make sure that your client gets off your table nice and slow to avoid getting dizzy and falling over. So there's the big salami there, the big whammy, the big shebang, the myocardial infarction, which is the complete old heart attack, right? That is the technical name for heart attack, which a heart attack is where the blockage to the coronary arteries occurs. And now all of a sudden we have, no blood flow going to that part of the heart, and tissue is starting to die. So, clear signs of a heart attack is usually deep pressure, pain in the chest, numbness, tingling going into the left arm, and, could be faint, could be, just feeling like the world's ending, all that good stuff. So, what do you do for someone if they should be having a heart attack in your clinic, right? So one, have them, just remain calm as possible, have them sit down so that if they do collapse, they don't hurt themselves or anything. And then, if they, like I said, if they do have their medication, if they have any of those nitroglycerin tablets, if they have, aspirins or anything like that, they can take that as well. That'll help to, potentially loosen up the blood, to thin the blood. And then, of course, make sure that you call, paramedics immediately, because in this case, they say that time is muscle, in this case, heart muscle. So the longer it takes to get treated, then the longer or the more muscle tissue dies. So, acting as fast as possible is going to be very important. Let's talk about, well, I guess we don't even need to talk about that, right? We kind of talked about with the congestive heart failure. What are your considerations should your client, have had a heart attack before, right? Well, same thing, right? They could have congestive heart failure. They could have other contraindications. They could have other heart complications. They could be on medications, right? All of that, just repeated again of what we would do and consider. So, just make sure that you screen properly. And then consider that they could have future episodes too. They could have future, heart complications or, cardiovascular diseases as well later in their life, even if they had a heart attack a few years ago. Phlebitis. So phlebitis is the technical term for inflammation of the veins. So inflammation of the veins in this case is a pretty severe thing. And so if they do have phlebitis, just postpone that massage, have them get treated, which is not to be, confused with varicose veins or anything like that, spider veins or anything like that, which we'll see, I think, on the next slide. But in this case, phlebitis is an inflammatory condition of the veins in the lower leg usually, and it can be associated with blood clots and so many other things. So no matter what, it's usually a pretty serious condition that you'd want to just avoid and have them get treated for. Our next one here is Raynaud's disease, which not a very common one to see down here in the South in Florida, just because it's always nice and hot and sometimes way too hot. But Raynaud's disease would be a little more prevalent in your northerner states because, well, what happens is that it's basically extreme reactions to cold, and it causes vasospasms in, usually the extremities. That'd be the nose, the hands, or anything like that, parts of the face like cheeks and stuff like that. What it does is it will increase the blood flow into the area, and decrease the blood flow. So basically your veins are just like opening and closing, opening and closing, opening and closing. And like so they'll get like red hot, and then they're just like, you know, lose sensation in them. So it's really not that big of a concern for massage, even if you do happen to you know, experience a client with it. You know, a big consideration is, you know, if they have cold allergies or, you know, reactions like Raynaud's disease to cold, consider, you know, the temperature of your room. And then, of course, if they do have circulatory issues, you know, consider the style of massage, you know, circulation massage. Varicose veins, which I'm sure we've all heard of and, you know, briefly understand. So, you know, shouldn't take too long to explain. But remember that varicose veins are the dilated veins because of the incompetent valves. So basically, you know, blood should be flowing in one direction in a vein. And so in this case, you know, blood became stagnant. Blood, you know, wasn't being moved through the system properly, and, you know, caused the vein to swell, puff up, dilate, you know, all that stuff. So what do we do? Well, one, if you do see on your intake form that your client has varicose veins, most commonly they're going to be in the lower leg or inner thigh. So that would be my immediate areas I would be cautious of when considering it. And then, of course, you know, you can always just ask like, oh, where are the varicose veins, just so I can be careful of the area. And so we typically tell you it's best to just avoid the varicose veins. However, working very lightly over them is not going to be the end of the world. But again, it's always risk management, right? So if should something happen because you went too deep and you weren't even paying attention and went over the varicose vein and then just problems arose, then you run into deeper issues, right? So, you know, very light pressure over the area. If you need, at best, just avoid it and only work proximal to the affected area, right? Because if I'm working distal, right? So if the flow of blood is this way, the varicose vein is here, I'd want to work from here up, right? And if this is the varicosity and my blood flow is coming this way and I'm pushing all this blood into this dilated area, then it's just a double whammy of stupidity. So I want to avoid that. So, you know, at best, you know, work proximal to the area, flush it out, and just be very cautious working over the area. You know, at best, you know, light pressure, or at best avoid it. You know, at worst, you know, just light pressure, and keep life moving. All right, so that was the cardiovascular system. Now we're into the urinary system, and we're talking about pee-pee. So what exactly is the functions of our urinary system? Our urinary system is actually quite complicated, and the processes by which it performs its functions is quite in-depth and really complicated, and literally has whole sciences devoted to it. Nephrology, as it's called. So we're only going to take a brief little snippety snip look at the functions and everything, and just understand the basics. So one, our kidneys will help to regulate the pH of our blood. And so we do this by the complex exchanging of ions and everything between the bloodstream and, you know, just all this stuff, right? So I don't even want to go into any more detail than that, right? We're just going to help to balance the pH levels of our blood, right? Our blood should have a certain pH balance, you know, relatively neutral towards the neutral line, and we want to maintain that. So our kidneys are responsible for regulating it. Of course, being that we pee, right? So that pee helps to regulate how much fluid is in our system. So again, there's hormones that are produced by the system, both through the heart and the kidneys itself, which monitor and tell us like, hey, we got too much fluid, we want to pee, or this, that, and the other, right? So therefore we can remove the excess water from the system. So of course, going along with the fluid balance and everything, if we're peeing and we're releasing fluid from the body, that changes our blood pressure, right? If we remove fluid from the body, that lowers our blood pressure. If we keep keep fluid in the body, that would increase our blood pressure. So a direct correlation on blood pressure with the previous thing there. Of course, our kidneys are responsible for filtering our blood. So therefore, they're monitoring our blood, and they can recognize like, hey, our blood cell count is actually kind of low. We need more, right? And so it can stimulate certain hormones to be released to cause the extra development of red blood cells. And then, of course, our kidneys are like one of the most main homeostatic organs, right? So homeostasis, remember, is like the balance of the body, right? Is what is basically responsible for keeping us alive. So our kidneys, very important, right? So our first condition up is kidney failure, also known as renal failure. There are many stages of renal failure. And the higher the stage, I think it starts at 1, goes up to 5 or something like that. And for every stage, it's just progressive more and more loss of function of the kidneys itself, right? I mean, and so as we saw, actually, I don't even think it was mentioned. Did we mention it? It eliminates the waste product. Yeah, okay, so we didn't mention that, but it also helps to remove waste product from the system as well, and filters and cleans the blood, right? So essentially, if you're in kidney failure, then your ability to do that is reduced. As a matter of fact, it in later stages causes high toxemia levels, basically toxins left in the body that haven't been filtered out in the bloodstream. And so what happens is people will need to go on dialysis, right? Most likely dialysis. And they're going to be on dialysis. Like kidney failure doesn't usually revert itself. It'd be a miracle if it really did. So you're usually on dialysis until you die or get that kidney transplant. So dialysis, depending on the stage, is a quite frequent thing. So, I mean, you could be on you could get your dialysis done maybe once a week, if you're lower stages and stuff like that. If you're, later stage, it could be as frequent as every day, right? And so, what do you consider with kidney renal failure for massage? Well, one, their body's already very taxed. So being vigorous and taxing with your massage style is not a good thing. Being very relaxed in general is always, the best approach. Again, since this involves blood flow and circulation, circulatory style massage is also more than likely off of the table as well, right? Because why would I want to make blood circulate through the system even more to be filtered and so on and so forth, right? And make the kidneys work even harder. Other considerations too is that, well, I mean, do you have a doctor's note too, right? I mean, is your doctor okay with you getting massage while you're in, stage 2, stage 3 renal failure, right? Make sure that you do have permission from their, physician to proceed. Other things to consider too is that people who are on dialysis, they go frequently, and dialysis takes a long time. Like you can be sitting there for like 3-4 hours as this machine just takes your blood out and pours clean blood back in. So, one, because of that, they might have ports, right, in their body so that it's easier to just hook up instead of jabbing a vein every time. So be careful working around the ports. Usually they're on the arms, most commonly be on the arms or, upper like shoulder area. So do be careful working in those areas, especially if they have ports. Another condition, but consideration too, is that if they are on dialysis and they do that frequently, they're really going to be very drained, which just goes again with, just being very relaxed relaxation based with our massage, right? Especially if they are drained. Pretty much your main gist there. So again, if make sure you get a doctor's note if absolutely necessary. Well, no, excuse me, not just if absolutely necessary, but make sure that you have approval from their doctor before you proceed, especially if it's very advanced stages. Better safe than sorry, right? And maybe even keep your sessions maybe a little shorter sometimes as well, because of the taxing of the body and stress that could be imposed on the body, and just the fact that they just be so much weaker than normal sometimes. So, yeah. Kidney stones, not necessarily a big concern for massage, but it's still a possible condition of the system, right? So typically these are little calcium deposits that find their way through the system, and they hurt, right? And they usually the only way to really get it out of there is to flush it out, or sometimes it can be broken down with their just fluid intake. And then sometimes you got to pee it, right? And then you hear the stories of grandpa passed his kidney stone, and then I don't know, you find it and you just, I don't know, make a monument out of it, put it on the shelf or something, admire it. Creepy, I know, right? But again, nothing massage is ever going to do about it. Nothing massage should be concerned about. But if all of a sudden your client is having like intense lower back pain, like spread right across the low back from side to side, that's usually a clear-cut sign that something's wrong with the kidneys, right? And especially if you do have a kidney stone and all of a sudden you notice and feel it, like, it's excruciating. I've seen people fall out from kidney stones and they are just like, they're like, please shoot me, in that much pain, basically. So but yeah, if your client does come in and they do have like that lower back pain, like not like right next to the sacrum, but like slightly, like just right level kidneys, and it's like unexplained, you worked on the area this whole time, you even worked the opposite areas, and it's just not getting better, it's just getting worse, it could be something indicative of some sort of kidney dysfunction. And I might even want to suggest that the client just go get checked out for any renal disorders. Incontinence, so this is usually more common with your elder clients, but this can happen with even younger people, and and nobody is necessarily free from it, right? Because of certain conditions could come along, weakness of muscles and so on and so forth. But incontinence means that you cannot hold your bladder, or in some cases bowels. And so if you're putting pressure on, or they sneeze, cough, or laugh, or whatever, and they pee myself a little bit, right, then there's some concerns with that, right? Anytime that we do have bodily fluids in the environment, we want to take extra sanitary measures and precautions. If your client literally just straight pees on themselves, just urinates on themselves, then, well, let's maybe wrap them up in a towel. Let's try to give them a moment to wipe down and clean themselves off. Especially if like they were already on the table, maybe hopefully the clothes aren't peed on. Maybe we can go get some like sandy wipes and they can wipe themselves off, get dressed, and then we reschedule the massage. If they came in and they peed themselves on the clinic floor, well, let's try not to make a big deal out of it and just let them maybe get a towel so they can wrap it around themselves and clean and sanitize afterwards. So same thing with any poo poo that they might let out. Poop and pee, funnest lectures ever, right? Urinary tract infection, UTI as we call it. So urinary tract infections usually is a burning sensation in the bladder, right? Especially burns when you pee there. So, one, urinary tract infections, again, not a big caution for massage, no problem for massage at all in general, anyways. So this can happen because of infrequent urination, because urine will also help to clean out the urethra of, which is, the tube that exits the, body. Pee exits the body out of that tube. But so infrequent urination, causes the, urethra to not be cleaned out, which then the bacteria enters into the bladder, and then, well, bacterial infection, causes the UTI. So again, this will actually affect women more commonly than men, simply because the urethra is shorter, so there's less distance to travel for the bacteria, and so it's easier to infect female bladder. All right, so our final system we have here is the digestive system. And, well, clearly taking more than an hour, but oh well, this will be the last system and we're done. Woo. So what exactly is our digestive system responsible for? Right, we're all very well familiar with it. We love it, right? Because we just love to eat and just delicious. So first, eating, right? We need to take food into the mouth, or ingest food, right? So we take food in the mouth, chew it up, and swallow it. So when we swallow that food, right, and chew it up and everything, we're starting the process of digestion, right? So we're breaking down food both mechanically by like grinding it up with muscles and teeth and so on and so forth, and then coating and soaking it in digestive enzymes and juices to break it down chemically, right? And so this digestion, this just breaks the food down into its, its tiniest little components. And then, of course, we secrete the digestive enzymes. But after we break all that food down, we absorb the nutrients and everything from the food, right? Well, we all know that we don't literally take everything from the food. There's usually waste product. And so, of course, we have to remove the waste. We defecate, poop, right? So what are our conditions and concerns? So an accessory organ to the digestive system is the liver. So the liver serves lots of functions. I mean, the liver is literally like the powerhouse of the body. It does so much for you. But one of the things is, as it's cleaning your blood and everything, it produces bile, right? As it actually removes red blood cells and stuff from the system, as it removes other toxins, medications, and everything that might be in the system as well. A byproduct of that is the bile, and that bile is used to help further digest food. So your liver can have a few conditions. One, cirrhosis, right? Cirrhosis is what we call the scarring of the liver, and cirrhosis, of course, progresses in different stages, but it's marked by the fibrotic scarring of the liver itself. And so what really causes this? Well, other diseases could cause this, such as like hepatitis, which I think is on our slides as well. But medications, one of the biggest medications out there that just, really wrecks your liver is acetaminophen, the simple old aspirins, basically, right? Because your liver has to filter that out. And so it can cause damage. Of course, alcohol, a big thing, right? Alcohol is also processed out of the body through the liver. And so alcohol itself as well can cause tremendous damage to the liver. So what do we consider with cirrhosis of the liver in our clients? Well, they might actually have some pain like in the abdominal area where the liver is located. So like the lower right side of the ribs, basically. They could just be generally weak and everything. Other things to consider too is maybe what if the cirrhosis was also caused by a blood-borne illness such as hepatitis, right? So that would be another concern. But otherwise, there's no major caution for cirrhosis. But yeah, at least you know now. Constipation. oh no, I can't poo-poo. So constipation is where the bowels are essentially blocked or the poop is not moving. The stool is stagnant or difficult to pass. So what happens here? Well, massage might actually be a pretty good thing in this case, right? Because well, we can perform abdominal massage, right? And abdominal massage may help promote the movement of the matter in the colon, right? So, and I mean, and just in general, right, relaxation massage helps to promote the digestive system and digestive motility and everything. So, massage could be quite a good benefit of constipation. Things to consider, though, is that they would probably have severe pain in the abdomen, so laying face down might be difficult or, just unpleasant. So, do consider that. Yeah, otherwise nothing too major that I can think of. Crohn's disease. So a form of IBS, inflammatory bowel diseases and syndromes. So this is where the digestive tract is inflamed, and so this causes like just really severe cramping, frequent stool passing and diarrhea and everything like that. It can really tax out the body too. You can have like severe weight loss and things like that. So no, there's quite a few postulated causes for Crohn's disease. A lot of times people will associate stress to a lot of the bowel disorders or digestive system disorders, right? Because of the role that the sympathetic division of the nervous system plays towards the digestive system, but no major correlation there. But regardless, relaxation massage may actually be a beneficiary thing. I guess that's a better term, or English, I don't know. It might be beneficial for someone with in general digestive disorders, especially maybe even potentially Crohn's disease. So other things to consider too is like there's no major concerns, but do consider that they might need to frequently get up, and go to the bathroom. So they might need to actually get off the table quite often. So be expectant that that could be a possibility or that could happen, and just be ready to excuse yourself out of the room and just let them get dressed and go to the bathroom. Yeah, I think that's about really all. Diarrhea, when you're climbing up a ladder and you feel something splatter, diarrhea. Well, we all know what that is. Nothing to really concern ourselves about with massage. If it just, unless it just happens in the massage room, right? Take your caution and sanitation to the highest level. And yeah, work with it there, right? Diarrhea's nowadays ain't nothing. Diarrhea back in the day was killing people, but now it's like just a good excuse to stay home from work, right? I got the mud butt, can't come in. Gallstones. So kind of similar to the kidney stones, right? Your gallbladder can again develop these deposits, these stone-like deposits. So first of all, what is your gallbladder? But the gallbladder is a little reservoir tank pouch below the liver that actually stores the bile produced by the liver, and then when needed, it just dumps it out into the small intestines to be used. So developing these stones, they can usually pass through the system, but if it becomes such a problem in that you can't pass them and the stones are excessive in the gallbladder itself, then it might be possible to have the gallbladder removed. And then gallbladder removal entails quite a few things. Nothing major for massage, but gallbladder removal might change their diet. They have diet changes. They could usually have weight gain because of that, and a couple other things, but nothing major here. So they might actually feel pain. They could feel pain or discomfort, and so typical referral patterns. I might as well touch on this. We call these visceral referral pain, right? So when organs, are feeling discomfort, or they have problems or anything, the pain can actually be transmitted to the surface of the skin. So just like in the instance where we talked about the kidneys, where you felt pain across the low back, right? That's technically a referral pain pattern from the kidneys. Well, the gallbladder and liver can actually refer pain, well, of course, locally where the gallbladder and liver are, but they could also pose it like right directly behind it, like into that inferior angle of the scapula, as well as towards the upper right shoulder as well. So, it might be in your best interest too to take a look at, visceral referral pain, because sometimes, if they just have, if your clients have unexplained pain in certain areas, that might be something to consider, right? Especially if you've exhausted all of their options and possibilities, right? Think about that, thinking outside the box in your client's care and treatment. GERD, gastroesophageal reflux disease. So this is where the acid, kicks up into the esophagus, and so your stomach is quite well designed to not digest itself with acids, right? So your stomach is well lined to avoid that, but your esophagus isn't. So when the digestive acids actually kick back up into the esophagus, then that causes that burning sensation, heartburn as we call it, right? And ouchies, painful, right? So lots of things can trigger heartburn, right? We always, some people will be like, oh, I got to stay away from these foods, right? They can trigger my heartburn, right? All the onions and blah, 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 peppers, whatever, right? But anyways, outside of whatever they're eating, what do we consider for massage? Well, position, right? So what happens if most people probably had some heartburn or acid reflux, then, what do? Well, you usually sit upright, right? Because, well, that just makes sense, right? To try to keep the acid down instead of coming back up. So same thing for your client on a table. Try to position them for comfort, right? So, maybe laying face down ain't going to be the best one. But, think outside the box in case it really bothers them. Usually, most people they get the acid reflux towards the evening. So maybe if you're massaging during the day, it won't be as common. But yeah. IBS, irritable bowel syndrome, again, kind of similar to Crohn's, right? Frequent passing of stools and pain and discomfort in the abdominal region as well. So again, consider the positioning of the client. Consider that they might need to get up off the table and excuse themselves to use the bathroom as well. Peptic ulcer. So peptic ulcers are, well, ulcers themselves are, sores and wounds, open sores especially. Peptic ulcers are caused by a, peptide that's found in the digestive tract, which then causes the lining of the digestive tract to, have an ulcerate. And most commonly, this is found in the, small intestines, and, very, very painful. So again, nothing concerned with massage and nothing to be benefited by massage other than just the general relaxation. You might want to consider, the positioning of your client itself. So, and any time that they might have, pain in the abdomen or abdominal pain from these conditions, laying face down might just not be ideal necessarily, but it's really up to whatever makes your client most comfortable. Hepatitis, as we briefly mentioned before, hepatitis, well, one, if we break that down, hepat refers to the liver. So this is inflammation of the liver. Now, this is typically a viral infection of the liver. There are so many different types of hepatitis. you'd probably have a whole degree just to learn hepatitis itself. But our main concern with hepatitis are a couple different types, mostly B and C. You know, I mean, usually they say Hep C being one of the bigger ones. Which is typically a bloodborne disorder. So, you know, again, just being very cautious anytime you're coming into contact with bodily fluids, especially blood, right? To, you know, make sure you take extra sanitary precautions in the regards towards, you know, bloodborne illnesses of this nature. So, I mean, if you're you know, just being concerned of the sanitary issue, you know, what do we consider about massage itself, right? Well, you know, damage of the liver, you know, can cause fatigue, widespread fatigue of the body. And so, you know, maybe a more relaxing based massage just might be a little more beneficial than normal. And that's it. Wow. Finally done. So we can stop the recording and